sheath is an aponeurotic sheath which encloses the rectus abdominis muscle. It has got two walls, anterior wall and posterior wall. Anterior wall is complete, that is completely covers the rectus abdominis muscle. It covers the entire length of the rectus abdominis muscle, whereas the posterior wall is incomplete. It only covers the middle portion of the rectus abdominis muscle. Above and below the muscle is not covered by the rectus sheath. The rectus sheath is described under three headings: above the costal margin, between the costal margin and arcuate line, below the arcuate line. So here you can see the cross section of the rectus abdominis. Above the costal margin, anterior wall is formed only by the aponeuros of external oblique abdominis muscle. Posterior layer is deficient. You can see here where the muscle lies directly over the 5th, 6th and 7th costal cartilages. 5th, 6th and 7th costal cartilages. Between the costal margin and arcuate line, you can see anterior layer is formed by the external oblique abdominis aponeurosis. Internal oblique abdominis muscle divides into anterior lamina and posterior lamina. Okay, so here the anterior wall of the rectus sheath is formed by the external oblique abdominis aponeurosis, anterior lamina of the internal oblique abdominis aponeurosis, and the posterior wall is formed by posterior lamina of internal oblique abdominis and transversus abdominis muscle. Okay, on the medial or in the midline, these three aponeurosis fuses to form the linea alba. Here is the linea alba. Now the third is below the arcuate line. All the three aponeurosis goes to the anterior aspect of the rectus abdominis muscle. That means the posterior wall is deficient. So anterior wall below the arcuate line is formed by external oblique abdominis aponeurosis, aponeuros of internal oblique abdominis and transversus abdominis. See here, the aponeuros of the external oblique abdominis muscle remain separate, whereas that of the internal oblique and the transverse abdominis fuses to form a structure that is a conjoined tendon. And posterior wall is deficient. There is no posterior wall. The muscle directly lies on the fascia transversalis. Now let us see what are the contents of rectus sheath. The rectus sheath, the contents are: there are two muscles, two vessels and 6 nerves. What are the two muscles? Already we know rectus abdominis muscle is present, and there is another small muscle which is present at the lower part of the rectus abdominis, that is known as a pyramidalis muscle. Next is two vessels are there. You know, here we have the superior epigastric artery, inferior epigastric artery. Superior epigastric artery is a branch of internal thoracic artery, whereas the inferior epigastric artery is a branch of external iliac artery. Okay, along with the artery there are veins also. So there are two vessels, that is superior epigastric vessels, inferior epigastric vessels, that means two artery and two veins. 6 nerves are there. What are the 6 nerves? Lower 5 intercostal nerves, and the next one is a subcostal nerve, that is T7 to T12 spinal nerves. So these are the contents. Once again, what are the contents? There are two muscles, two vessels and 6 nerves. So say along with me, what are the two muscles? Rectus abdominis, pyramidalis. What are the two vessels? Superior epigastric vessels and inferior epigastric vessels. Remember, superior epigastric artery is a branch of internal thoracic artery, whereas inferior epigastric artery is a branch of external iliac artery. Then 6 nerves are there, lower 5 intercostal nerves, and the last is the subcostal nerve, that is T7 to T12 nerves. Okay, then one more term what we have gone through when we described the rectus sheath is the arcuate line. So what is arcuate line? Arcuate line is lower free margin of posterior lamina of internal oblique abdominis. You know, the posterior lamina or the posterior layer of the wall of the rectus sheath is incomplete. Above and below it is deficient. If you see the lower margin, okay, so this is the internal oblique abdominis muscle. So this internal oblique abdominis aponeurosis ends as a sharp margin between the pubic symphysis and the umbilicus. Okay, so that sharp margin is known as arcuate line. Okay, so how will you define arcuate line? Arcuate line is a lower free margin of the posterior lamina of internal oblique abdominis. It lies midway between umbilicus and pubic symphysis, and it is also known as the linea semilunaris or fold of Douglas. Remember, linea semilunaris or fold of Douglas. And what is the shape? It is concave downwards. You can see it is concave downwards.